Bppv or benign proximal positional vertigo is one of the most common and bothersome balance disorder in adults. Although it's not life-threatening, but it can severely reduce the patient's quality of life. I'm Faiza Mohammadi and I'm winter and an audiologist student. During my clinical training in audiology clinic, I realized that Bppv counts for about 20 to 30% of dizziness cases in adults. Patients often feel the world is spinning around them when they change the position of their head. This condition is sometimes accompanied by nausea, sweating, or involuntary eye movement, and it may even lead to falls or fear. The cause of this problem is in our inner ear where the vestibular system is located, and calcium crystals called otoconia can move into the semicircular canals due to aging, head trauma, or lung immobility. This sends wrong signals to the brain and cause vertigo, especially with the head movement.
Our sense of balance is controlled by our vestibular system located within our inner ear. This system is made up of 3 tubes called canals and 2 pockets called the otolith organs that contain tiny calcium carbonate crystals. Combined, they provide feedback to our brain about our head movement. Sometimes crystals fall out of the pockets and into a canal. If this happens, it can bring on a sudden brief spinning sensation. This condition is called benign paroxysmal positional vertigo, or Bppv. It's the most common vestibular disorder.
A common treatment is Bppv maneuver, which moves the crystal back to their original place through precise movements of head and body. However, this technique needs a skilled therapist and a specific clinical condition. Reaching a clinic during a vertigo attack is difficult and dangerous, especially for elderly people or those who live alone. Also, performing the maneuver requires precision, and factors like patient weight or therapist fatigue may reduce its accuracy. Additional challenge of this method includes the lack of digital data and high cost of in-person session and transportation, and in some cases, the patient's anxiety about interacting with therapists. All this challenge inspired me to design a smart balance therapy chair that performs the Bppv maneuver automatically, safely, and precisely without needing a therapist. The chair follows the same standardized movement used by professional therapists. It is equipped with sensors that detect angles, body position, weight, pressure, and even vital signals like heart rate and blood pressure. The patient simply sits on the chair and fastens the safety belt, wears a smart headband and wristband. From there, the chair automatically performs the maneuver. The patient's head turns to the desired angle using elastic bands connected to the precise servomotors, and the body is positioning using linear actuators and multi-jointed frame, even rotating the patient to the side by using pneumatic system. At the final step of maneuver, I realized that getting up from sideline position can be hard for patients. To solve this, I added a rotating platform under the seats and footrest, which turns at the right moment and helps patients return to a standing position smoothly. All sensor data is sent to the central microcontroller that controls the entire process. If anything goes wrong and abnormal, the system alerts or stops automatically. The patient can also share feedback by dedicated app which sends all data to the therapist so the patient can stay in touch with their therapist. This smart chair improves safety, accuracy, and comfort in treating Bppv. It reduces cost and anxiety and makes treatment possible even at home. Especially for the elderly people, and people who live alone or those who are anxious about in-person therapy. Dear audience, I sincerely thank you for your support of my invention and for your kind attention.